Bangalore, as the global population continues to age, the prevalence of diabetes among the elderly has become a growing concern. Athulya Senior Care recognizes the urgent need for efficient diabetes management, tailored specifically for older individuals. By addressing the unique healthcare needs of seniors, Athulya Senior Care is at the forefront of promoting a holistic approach to diabetes care, emphasizing tailored exercise, dietary control, and specialized supervision. At Athulya Senior Care, we are committed to empowering the elderly, enabling them to lead healthier, more fulfilling lives despite diabetes. By emphasizing tailored exercise, dietary control, and specialized supervision, we aim to enhance their well-being and promise a brighter and healthier future for the aging population, said Dr Umapathi M, General Physician, Athulya Senior Care.
I'm Dr Umapathi. I'm a senior physician and diabetologist and working as a Chief Medical Officer in Athulya Senior Care. Now, Athulya started as assisted living, and now we have changed it to Athulya Senior Care. It means anybody above 65 years with any condition like going to the hospital, undergoing any surgery or any cardiac event, they can come back to us for a transitional care. So we have a lot of care plans in Athulya, like depending upon the primary diagnosis. We have hypertension care, diabetes care, Parkinson care, palliative care, and people coming from the hospital, transitional care. And we also have dementia care here. So all care is being given here in Athulya. And Athulya's service is not like a hospital. It is like a home where we have trained nurses, with skilled nurses who take care of like ICU patients, how they take care, and those type of service is given. And we have a department for rehabilitation in all our facilities where trained physiotherapists give them physiotherapy regularly. And we have a nutritional department where we cut down the calorie for diabetes or salt restriction and hypertension and increase the protein level for them. We have trained caretakers here who give them 24 hours care where they are not able to balance themselves to walk. For example, like Parkinson's disease, that will be difficult in walking. They need some assistance for them because of the tremors. And we also have occupational therapists who find difficult to swallow, or swallowing therapist will come and train them how to swallow it. And people who are tracheostomy care. We have critical care doctors here who are emergency doctors who take care in case of emergencies when they land up in case of chest pain or any heart attack, to give them immediate attention and treat them in the emergency conditions. And we also have a doctor to take care of dementia, because in elderly people dementia is very common. As a nutrition part, we have a bigger department in all the centers where dietitians are being deployed in all the centers. They are all senior dietitians who take care of the diet and nutrition. Now, to talk about diabetes, diabetes is a common metabolic disorder. It's an ongoing disease, and most of them have been undiagnosed most of the time. And that's the reason there is a diabetic day which have been celebrated last 14th diabetic day, and it to create awareness. At Athulya, what we do when they come for an admission, we do a comprehensive examination, and we get to know all the history, medical history of them, and thereby we know where they stand and what is their sugar level and other conditions. But in diabetes, like when they go to the hospital, they might go for a review for 1 month or a couple of months later. But here there is a regular monitoring of sugar levels. For example, people who are being on multiple insulin, so we also do multiple times and find out whether there is a fluctuation in the sugar level. If it's very high, we try to adjust the insulin level. If it's very low, we try to adjust the insulin level and other hypoglycemic drugs also. The most benefit and advantage how the care we give here in diabetes is day-to-day monitoring. So every day there will be a vital checkup where it includes also to check the sugars in diabetic patients. So that gives us a clear picture of whether it is under control or not under control. And once in 2 months, 3 months, we do this HbA1c to find out the control of the diabetes. And strict control of calorie level, we cut down the calorie and increase the protein. So thereby there is a good control of diabetes because of the daily monitoring of the blood sugar levels. Diabetes being a chronic metabolic disease, and they might go in for complications like diabetic retinopathy and diabetic neuropathy where it's a very nagging pain what they have, like a sort of pricking pain, burning sensation, numbness, which leads on to a diabetic foot, diabetic ulcer. And there is another common complication as diabetic nephropathy. So to prevent all these complications and to stop them and going to the progression of the disease, we keep them always monitoring the drugs and revising the drugs so that it is kept under control. Now to talk about the diabetic pain, it is one of the very bitter experience where these people experience, and there are some drugs which are antidepressant, tricyclic antidepressant which you give them, and it will come under good control. And certain exercises also recommended to keep the diabetes under control. Diabetes, simple exercises will definitely help them. Depending upon their mobility, the exercises are recommended. As I said, we have a physiotherapist in all the centers. They do the assessment and they recommend what type of exercises to be done. But this exercise is very, very important for one to control their diabetes. Diabetic foot ulcers, and this ulcers is being daily cleaning and dressing has been done, and a tight control of diabetes is made, and they recover fully and the ulcer has healed well. And people coming with a diabetic chronic pain also, this is a progressive disease where the diabetes has to be kept under control, not to progress the disease and go in for a complication. But once it goes into the complication, we can only stop the progression, but whatever damage has happened, it's very difficult to treat. But with the certain drugs, we have seen people coming out to the pain and we treat them with the medications with antidepressant and keeping the diabetes under control. We have seen people come out from the pains and thereby we can improve the quality of their life. Many people you have seen coming with the suffering of the pain and very difficult, always shouting in the pain, but after we decrease the pain, the quality is increased and they feel very much comfortable. That is not the one reason also. When they come here, we make them mix with the people where we have a lot of activities in the evening. So that is socializing with the people also will bring down the stress level and thereby increasing the dopamine level, which also makes them very comfortable and improve their quality of life. For diabetic patients, we usually cut down their calorie, the carbohydrates, we usually lessen it down. We replace them in a sort of increasing the proteins, more of sprouts, cereals, pulses, and soya. So what happens in elderly people, we usually see a wasting of muscle, and diabetes itself, we see a lot of wasting of muscles, the condition called sarcopenia. To maintain the muscle mass, we always give them more of protein diet and decrease the calorie level. And they have to do a lot of exercise to keep them maintain their muscle mass. Depending upon their mobility, the exercises have been taught to them. The exercise mainly we recommend is walking, and people who are very active, they can do jogging, and some sort of low weight lifting is also recommended. They can do a small weight like a 5 kilo weight or whatever is tolerable, they can lift and do it. That also reduces the adipose tissue, the central obesity get reduced. And we also recommend cycling. Cycling is one of the good exercise. When they are very much mobile, they can do cycling. People who can swim, they can do swimming also. And these are the aerobic exercises. Depending upon how they are active and depending upon their mobility, they can do these exercises. We have a physiotherapy department, so they hold them and make them walk. And this walking exercise will definitely increase the blood circulation.
Is there any case study in Athulya, like the people, the senior elderly people who have got more diabetic, like 400, 300, something like that, and after joining to Athulya, it come?
For older people, controlling diabetes is very much challenging because one is they don't adhere to the lifestyle or the food pattern. And in Athulya, we have seen many of them coming and getting admitted with glucotoxicity, where the sugar levels are very high. It happens because they don't have a follow-up with their doctor. That is, the reason is they don't have anybody to take them to the hospital regularly for a follow-up. So they will be taking the same medication for a longer time. They may not know whether it is under control or not under control. So when they come here, we have a package to rule out what diseases, existing disease they have. So it covers a liver function test, a kidney function test, and diabetes, and some tests for hypertension, and general test to find out whether they are any infection. Like that, we have come across many people coming with uncontrolled diabetes, where we have started on insulin, where it is very difficult to convince them to start on insulin. But in older people, it is better to start them on a minimal dose of insulin to get it controlled. We have people coming from US also with uncontrolled diabetes, and many patients we have controlled them, and their quality is already almost have been improved like that, because with the high sugar they feel always weak, tired and exhausted. When their children bring them with saying that they are not getting up from the bed, they are always weak, they keep lying on the bed all the time. So when we find out that their sugar level is what is being bothering them, when we have brought them into control, many, not one or two to cope with, we have seen, and they have become very active after the control of diabetes, and the quality of life has been improved. Likewise, we have got, I think, to a number, maybe a handful of clients came with hypoglycemia, which the children and we usually say resident or client, we don't say patients. So these clients will also be lying on the bed all the time, and children may be thinking because of the old age they are like that. Then we have found out that it's because of the low sugar hypoglycemia, and they are on multiple drugs, and we started tampering on all these drugs. When the blood sugar was maintained to a normal, they became very active. Athulya, we do a lot of activities, keeping them not only engaged, to keep them engaged, it is to not to decline the cognitive function. So we don't want the memory to get lost fully. So for that, we have social workers who plan activities according to their comorbid conditions. Some may be having dementia. So for them, the activities will be a little different. And we always call people for musical therapy, where the music also increases the dopamine level. And a lot of activities like paintings, drawing, and quiz competition, singing, we make them sing. So it's a different type of activities which are being planned every day for the whole month. It is being planned they get engaged with activities, thereby they get socialized, and the socializing itself is a sort of exercise to the brain. To talk about Athulya facility, the rooms have been designed so friendly. They have a homely atmosphere. The main thing what we concentrate, and the facility is made for the elderly people, is it's zero fall, which is what we expect. We don't want anybody to fall. So when we look at the floors, it's all non-slippery floors, all wooden floors, and these non-slippery floors have been designed inside the restroom also. And you will see on the walls that all they will have a grab bars where they can hold and walk to prevent fall. And all the rooms will have a clinical cot. This clinical cot is designed in such a way that the foot end can be raised, the head end can be raised. There is a side rise where they don't fall it. So we recommend and insist everybody to have the side rise so they don't fall from the cot. And we have a call bell system where it's with the call bell is given at the side of the bell. In case of any emergencies or need of help, they can ring the bell and immediately a nurse or a doctor or a caretaker can rush inside and help them. And this call bell system is also inside the restroom also. And to prevent them for fall, all the closets in the restroom, they have a toilet raiser also. People who have joint pain, arthritis, they find difficult to sit and get up. So we have a toilet raiser inside all the restrooms. This is for the fall prevention. Apart from this, Athulya conducts all festivals is being celebrated: Independence Day, Republic Day, Pongal, Diwali, Krishna Jayanti. Everything is being celebrated. And we have a puja place where residents gather every Friday and do their puja. So they can worship whenever they find time, or they wanted to go to God and worship, they can do it. So it is all like a home only, where they have a feeling of homely atmosphere they have. Athulya Senior Care is largest in South now. We are already functioning 9 facilities across South. We are the premium caregivers. We are very unique compared to other people. What is the success when people want to copy us is the medical attention and the nursing care and service what we give. So in case of any emergencies, they need not run to a hospital where doctors are here around the clock. So we give attention. It's like a hospital. They are staying in a hospital, but it's like a home only. But the medical attention what we give is 24 hours. Even when the doctor is not present, also they can make a video call to a doctor and find out what it is, and it is treated immediately. So keeping all the comorbid conditions under control and day-to-day monitoring is what we are very